Kia ora koutou katoa. Welcome to the update today. Today we have 2 new confirmed cases of COVID-19 to report and 1 new probable case. 2 of today's cases, and those are both the confirmed cases, can be traced to a known source. One is linked to the Marist cluster in Auckland and the other linked to the Gladys Mary Rest Home in Hawke's Bay. The probable case, which is from South Canterbury, is currently under investigation. So the new national total of cases, both confirmed and probable, is 1,472. There are no additional deaths to report, and New Zealand's total number of confirmed cases is 1,124. This is the number we report to the World Health Organization, and in many instances, this is the number that many countries report as their overall total. Yesterday, there were 2,146 COVID-19 tests processed around the country, bringing the combined total to date to 126,066 tests. Again, this lower number of tests reflects the pattern we have seen, for example, over Easter when there are public holidays. Of our cases, 1,214 are now reported as recovered. That is, they have been symptom-free for at least 48 hours, and it is at least 10 days since the onset of their symptoms. That's an increase of 34 on yesterday, and now 82% of our cases are classified as recovered. Today there are 9 people in hospital around the country, and that includes 1 person in ICU in Middlemore Hospital. And there are still currently 16 significant clusters around the country, that is, clusters of at least 10 or more people. In terms of the cases still under investigation, since the 1st of April we have just those 2 cases. I mentioned one yesterday. This is the case in Tauranga, for which there is a possible link that is still being investigated. And the other one is the one I've just announced from South Canterbury today. It's a probable case. Just a word on elimination. I want to restate the comments I made yesterday about elimination, which may have caused some confusion about what this means in Alert Level 3. First of all, a reminder that we still will see cases of COVID-19 under an elimination goal. That just means that it is not completely eradicated, and you'll have heard Professor Sir David Skegg talk about the difference between elimination and eradication several weeks ago at the first meeting of the Epidemic Response Committee. To date, we have been, of course, considering elimination under Alert Level 4, and as I said yesterday, we have achieved what we set out to achieve under Alert Level 3. That means we know we have a small number of cases, and we know where those cases are coming from. We have the ability to undertake ongoing and extensive testing, and we can contact trace a significant number of cases each day. However, as you will have heard today, we still do have cases ongoing of COVID-19, and we have seen from overseas experience how quickly those numbers can rise again if we take our foot off the pedal. We have made good progress to arrive at Level 3, but we are by no means in the clear. Elimination is not a point in time. It is a sustained effort to keep it out and stamp it out over many months. It is crucial that all New Zealanders remain vigilant and follow the guidelines for Level 3, including physical distancing. And yes, like many people returning to work or back at work today, I have enjoyed a takeaway coffee. However, it is important not to congregate outside the cafes or other places or in the car parks of takeaway places like McDonald's when you see old friends. Please do maintain the physical distancing. That will be imperative in Alert Level 3. We do not want to see the sorts of rebound that we have seen in other countries. So physical distancing imperative, keep to your bubble, practice good hand hygiene, and if you are unwell, most importantly, stay away from work and from others. Finally, as I outlined yesterday, as Director General, I have issued a new order under the Health Act, which lays out the provisions for Alert Level 3. This came into effect at 11:59 last night when we moved into Alert Level 3. The information in the order is comprehensive and it outlines the functions around isolation or quarantine requirements, the permissions for essential personal movement or recreation, infection control measures that are required of all premises, the ability to close non-compliant premises, and also prohibitions on gatherings. The notice is available on the Ministry of Health website under latest updates and also is linked to from the Ministry of Health's dedicated COVID-19 page. Thank you. I'm happy to take questions.
Dr. Bloomfield, did you misspeak yesterday when you said that we had achieved our goal of elimination? Because now you've clarified that to say that elimination is not a point in time.
We've achieved our goal of elimination as under Alert Level 4. So we have achieved what we set out to achieve under Alert Level 4 as part of our overall goal of elimination. But as I said, it remains our goal in Alert Level 3, and it certainly will in Alert Level 2, but it is not something that you can just say, done and dusted, we've got it, we are under elimination. It's we have eliminated. It's an ongoing effort.
What's the scientific definition you're using to define elimination?
So again, I think we're in a situation of COVID-19 that we haven't experienced before, and I just want to refer back to Professor Sir David Skegg's definition, which I think is helpful, and it is our goal. A small number of cases, a knowledge of where those are coming from, and an ability to, and a posture to identify cases early, stamp them out, and of course to maintain strict border restrictions so we're not importing new cases. That's what underpins the elimination goal.
Can you only say at the end of Alert Level 3 if we've been successful in elimination under that alert level?
No, I think alert level elimination will continue to be our goal and underpin our approach. In a sense, it's a single word to describe that ongoing keep it out, stamp it out phase, different from what was in the pandemic influenza plan, which talked about moving into a manage it phase. We clearly decided we wouldn't do that, and we have seen what has happened in other countries and jurisdictions where they have either deliberately by choice or have had that choice taken away where they have moved into a manage it phase. We decided we wouldn't do that, that we would go for an elimination goal underpinned by sustained keep it out, stamp it out.
Would we be slipping out of elimination? What would, so you say we've achieved our goal of elimination, what would need to happen for us to have slipped out of having achieved that goal?
Well, I think the point that the development that every country is looking to is the development of a vaccine and or an effective treatment or treatments for COVID-19. Then we could look at what the goal might be once we had effective treatments and or a vaccine. But in the meantime, the goal of elimination will be what will see us through as New Zealand to that point.
That criteria that you said before that Sir David Skegg said, we are at that stage in all those certain phases.
Yes.
So
yes, again, and I think that description applies very aptly to what we have been doing under lockdown, but we will continue to want to remain at a point where we have a low number of cases and where we are able to identify early through testing and then isolation, contact tracing and isolation of any contacts. That will be what will help us achieve ongoing, sustained elimination really through these next few phases.
Are you concerned that New Zealanders will hear you say, look, we've eliminated it and breathe a sigh of relief?
Yes. Well, then I can just clarify. We haven't eliminated it and we haven't eradicated it. So elimination, as I say, is not a point in time. It's not, we've got to the end of Alert Level 4, we've eliminated it. Our elimination goal continues into Alert Level 3, and as I've said quite clearly over the last couple of weeks, to maintain that we need to be even more vigilant because we don't have the full protections that a lockdown brings with it.
Talking yesterday, you were talking just specifically about Level 4.
Alert Level 4, yes. So, and this was one of the key pieces of information behind the decision to move out of Alert Level 4 was, yes, we have achieved what we set out to achieve under Alert Level 4 for a low number of cases, an in-depth knowledge of where they are coming from, control of any clusters or outbreaks, very good testing capacity and widespread testing underway, and also that ability to contact trace.
In her report on contact tracing, Dr. Verrill identified a number of sort of key performance indicators,
Yes.
including 3 of critical priority. Has the Ministry of Health achieved those 3 critical key KPIs?
We are well on the way, and again, it's not just the Ministry of Health, because the fundamental workforce that does the contact tracing is out in our public health units. And if you recall her first recommendation about capacity and capability in public health units, when we started to get cases in New Zealand, we canvassed our public health units, and their capacity at that time was around 50 cases that they felt between them they could contact trace. That's now up to 185 with the investment that's happened, and with the further investment, we're increasing that up to 300. So that's the fundamental capacity we will need. And then we've got, of course, our national contact, close contact service that supplements that with the ability to contact up to another 10,000 phone calls each day. In terms of those indicators, I think the critical one is the one around the timeliness of contacting people who are identified as close contacts. And one of the challenges here has been collating data which has been manually collected locally by public health units. We have just got a good, what I think is a good picture of that with data from the public health units for the period from the 13th to the 17th of April, and that showed that they were contacting and tracing 80% of close contacts within 48 hours actually, and the benchmark there is within 72 hours getting 80%. Now, of course, what we want to be able to do is to continue that, and even if there is an increase in cases, to maintain that, achieving 80% within the 2 days.
Now that we switch our attention to going down to level 2 and what we have to do, if we keep tracking with these single-digit number of cases, what else do we have to do until you're comfortable for us to flick into level 2?
Well, it's, again, the number of cases and, of course, the knowledge that where they're coming from. The other thing will be to maintain early testing of people who are symptomatic, and this, again, is a really important point for people who do have any respiratory symptoms, to seek advice early. And those include more severe symptoms like fever and cough, but also sneezing and sore throat. And this particular symptom that's now become quite well documented of a loss of smell or taste, which not only seems to be a symptom that people have when they might be developing the illness, but also can continue for some time. So if people have those symptoms, early testing is critical, and then supplementing that with our ongoing wider testing as part of our surveillance, including of critical workforces like essential workers in healthcare settings and in non-healthcare settings.
Smell and taste, is that now one of the official symptoms? Because
Yes.
Okay.
Yes, it's in our case definition now. Yes.
Sorry to that change.
A Hamilton man has stuff about he went to see back 12 days ago and was yet to receive a test result. Is that kind of delay happening around the country, and is that acceptable?
No, it's not happening around the country, and it surprises me that someone's had to wait 12 days, so I'm very happy to look into that and just check. What I can say is that every positive test, the person is contacted immediately by the public health unit, and it may take longer for people to receive confirmation that their test was negative, but also, of course, our positive tests are announced each day here as part of this stand-up. But it shouldn't be taking 12 days. It shouldn't be taking more than a few days for anyone who gets a test to get that result back. So we'll follow that up.
Based on what you've seen today, when you've gone out for your coffee and what you've heard from people, is the level of activity that you're seeing today in level 3 what you would hope for, or have people already got a bit loose?
Well, what I was seeing was fine, but I have had reported to me that, and hence the message, there will be a temptation. You see your friends, you haven't seen them for a few weeks, whether you're congregating for a coffee or takeaways, to just want to catch up. And it's the physical distancing thing remains very important. I just want to reiterate that message to people. We've got used to doing it during Alert Level 4, and it's imperative to maintain it through Alert Level 3.
When were taste and smell added to the official symptoms of COVID-19?
Look, I think the last change to the case definition was the 16th of April, and I'm I'm pretty sure it's in that, so I'm happy to confirm that, but we've certainly added as a very distinctive symptom, and it's one that all the CBACs are now aware of.
There's information on the ministry.
Dr. Bloomfield, you mentioned last week, you talked about ramping up testing in rural areas. I believe you said Te Tai Tokiro, Te Tai Rāwhiti, Taranaki, among others, with a particular focus on Māori and Pacifica. How has that testing gone, and are you pleased with the testing rates among Māori and Pacifica?
Yes, we've seen ongoing high testing rates amongst Māori and Pacifica, which is good, and the feedback I've had is that that testing's gone well out in the Tai Rāwhiti, Te Tai Tokoro and Taranaki, and we will be continuing that as appropriate. We haven't seen any positive results or tests come through from that testing, which is, I think, reassuring both for us and, of course, for those communities.
Bloomfield, is the information on the Ministry of Health's website about the extent of community transmission misleading? And if not, why is the Ministry not saying it's community transmission when someone gets the virus locally from a cluster or case, when the origin of that case or cluster is unknown?
Okay, so there's quite a bit in that question. So I don't think the information is misleading. What we have moved to over the last few days is, rather than broadly talking about community transmission, is just to be more specific about the origin of cases. And in some cases, it will be from community transmission, but related to a known case or cluster, even if we don't know where that case or cluster came from originally. In other cases, in a small number, we are not able to make that link. Most of those, aside from two, are pre-1st of April, so 4 weeks ago now, and so they will be the ones that are contributing to that overall percentage that are community transmission. What we're critically interested in now is being able to trace where our recent and emergent cases come from and being able to link those to existing cases.
What have you received about these larger blood vessel clots and strokes that younger people appear to be having who have had COVID-19?
I haven't received any advice, but what I can say is we're keeping a really close eye on any emerging reports around clinical presentations. There have been, this is one, there has been in the last week these reports around vascular and blood changes. There's also an emerging report from the UK just today around the possibility of there's only a small number, but a small number of children with Kawasaki disease, and some of these had been COVID-19 positive, others hadn't. Again, a small number. So these are the sorts of things we are looking at on a daily basis just to see, is this something we need to advise our clinicians about to look for? So what does seem to be clear is that this infection, even though it's a respiratory infection, does affect other organ systems, and as we learn more about it, that will inform both how we manage people, and then of course also it will identify groups that might be at high risk that we need to act on early.
Does it serve as a reminder as well to younger people, because I think those strokes have all occurred in people who are under 50 years old, that this isn't just a virus that disproportionately hurts older people or people with underlying health conditions?
Quite. It's not just confined to those groups. And we've seen in New Zealand our biggest groups in terms of age groups that have been infected, largely reflecting people coming back from overseas and the nature of some of our clusters. The biggest groups have been sort of 20 to 40-year-olds. They're not as susceptible to the poor outcomes, but that doesn't mean that they don't get those. And we've seen overseas, where you have high numbers of cases, you do see some of these people get very unwell, and some of them die. And even in the UK, in that report around Kawasaki disease I was reading today, they have had a small number of deaths in under 20-year-olds related to COVID-19. It is not an innocuous infection in any age group.
What would the testing results been for the residents at a Hawke's Bay holiday park where a resident tested positive for the virus?
Yes, so I was really pleased to see the Public Health Unit yesterday has offered testing to all those people at that holiday park. I don't have the results of those yet. We certainly haven't seen any positive tests come through in the reports today. I'm assuming that most of those will be done today and processed today, and we'll be able to report back on that.
To confirm that was at the affordable West Shore holiday park in Nathan?
I don't know which holiday park it was actually. I'm sorry.
And just
Hutt Valley and CCDHB have had to ditch 100,000 face masks from emergency reserves. How disappointing is that, and what does it say about the inspection processes of our PPE still?
Well, I think it does provide a lesson that, and I know that most DHBs do have a rotation policy, and we do that for all our pandemic supplies, including the supplies we have of Tamiflu, which are rotated out, and we have also pandemic supplies of things like paracetamol. They're rotated out to maintain the levels. I think there is a lesson for there. What I can say is we have got 29 million masks in the country, both N95 and the standard mask in the country. So disappointing that those ones had to be written off, but we do have both good stocks and good supply chain of masks.
As a health professional, noting New Zealand's obesity rates, how did you feel about the flooding of Kiwis to takeaway food outlets today? Is there a public health message you'd like to put out there, or is that a bit preachy?
Well, I think, I don't want to be preachy on this. I was pretty keen to get a takeaway coffee, and I think people are enjoying the opportunity. So I'm not going to pass any judgment on that. One more observation I will make, though, is, and I think others have made this, there's been a lot of people out being physically active during Alert Level 4, and walking, cycling, and I think we will all be feeling all the better for that, and I'd encourage everybody to actually in Alert Level 3 and even as we move down alert levels to maintain that regular physical activity. We know it's beneficial for health even if you, whatever age you are, and even if you have pre-existing conditions, physical activity is of great benefit. So I'd just be encouraging people to maintain that.
Thinking about extending bubbles, if you're extending your bubble to an older family member, can you actually hug them when you enter their home, or do you still need to keep your distance from them once you're inside?
Well, theoretically, if someone's within your bubble, you are allowed to hug them, and that may be one of the benefits of extending your bubble. But of course, you do want to be thoughtful about that, and of course, if you've got any symptoms of a cold, not only don't hug them, but don't see them.
Any sense of overall mortality rates over March and April? There's some studies of overseas hotspots for COVID where overall mortality spiked a lot more than actually reported cases. I'm not saying it necessarily happened in New Zealand, but have you looked into whether overall mortality is any higher in March and April than it was, say, last year?
We haven't looked yet, but that's something we will want to look at all-cause mortality during the period, because we also know some people have delayed seeking care, and we'll want to make sure that there weren't excess deaths related to delays in seeking care. If you look at those countries where and I think the Netherlands is an example, I think the US may be another one, where actually their mortality rates have been quite a lot higher even than the additional COVID-19 deaths. I think this reflects that their testing was not identifying all the cases out there, and there were many community-based deaths as a result of COVID-19. What we've, of course, been in the position in New Zealand, we're confident we've been able to identify the vast majority of our cases, and so our death rate is on a par with countries like Australia and others that have got high testing rates, so somewhere between 1% and 2%, whereas what you'll see in, say, the US, the death rate is much higher, even approaching about 10% of total cases.
So you're quite concerned about people maybe delaying care and dying because of that, maybe not going in when they should and having a heart attack or something similar?
You'll have heard us through Alert Level 4 repeatedly encouraging people to seek care in a timely way and avoid, especially if it's something like chest pain or symptoms that really do require them to get urgent care, that they should not delay. And that continues into Level 3. That people should seek the care they need, whether it's acute or for more long-standing chronic conditions. And we will be looking back at all-cause mortality just to see whether what the impact was of COVID-19, including whether there were any increased deaths from infectious causes. However, I could also say that we've been quite inclusive in terms of our deaths that we have classified as COVID-19, including a number of probable cases, even where the testing was negative, but we felt it was likely to be a case.
Considered any sort of wider antibody tests that kinds that are done in New York to get a more fuller picture of prevalence of COVID in New Zealand?
It's one of the things we're considering further down the track as part of surveillance. It will depend on there being a reliable antibody test. I think there are still some questions around the reliability and usefulness of antibody testing, particularly in a situation like New Zealand where we've had a relatively, such a low number of cases. Of more value, and I think you'll see the states, I think New York's done an antibody test of a sample of New Yorkers and found they thought around 10% of the population has probably been infected. It's of more value there, whereas here we've got such small numbers, and if the test is not that reliable, it's unlikely to provide any useful information until we get, I think, really much more reliable antibody tests.
Do you have any comment on Auckland University Rod Jackson's analysis that there might be undetected cases equivalent to the amount of active cases we currently have?
I think we've always understood that there would be other cases out there that we might not detect. I'm not sure if it's an equivalent number to the ones we have found, but the key point and the key benefit of the lockdown has been that even if those cases were out there, they've clearly not transmitted on to others because people have been staying within their bubbles, or the majority of people have. But this will be one of the things we'll be really want to be very careful about as we go into Alert Level 3 and further on to Alert Level 2, and hence maintaining that wide testing, case finding, and testing of certain populations to identify whether there is any COVID-19 still out there. Maybe the final question.
Yeah, this morning during the select committee looking at the impact on small and medium businesses, we heard from a business owner in Auckland who runs a shopping mall, and she was saying, look at these tiny numbers of positive cases we're getting each day. Today it's 3, we've had 5, 8. She was saying, look, she feels that we've beaten this thing, and she thinks it's madness that malls like hers have to remain closed at level 3. What would be your response to that?
Well, I can understand that perspective, and I think for all New Zealanders we look and I think we should feel proud of the efforts we've made to get down to this small number of cases. However, to repeat a comment I've made here before, it's quite clear this is a tricky virus, and as we learn more about pre-symptomatic and asymptomatic transmission, that it makes it all the more important we maintain the approach we are maintaining. And I'd also point to countries, in particular ones like Singapore, that also had very small numbers of cases and then saw a big increase and now finds itself in a very different situation. We don't want to be in that situation, and we want to make sure that we get the full benefits of the sacrifices we have all made under the lockdown Alert Level 4. So that would be my response there.
Yesterday we'd achieved our goal of elimination. Today we haven't eliminated. Have we eliminated the virus or not?
Let's be clear, and I'll just repeat the comment. Elimination is not a point in time. Yesterday I was referring to Alert Level 4. We had achieved what we set out to achieve in terms of our overall goal of elimination under Alert Level 4. This is going to be a prolonged effort, it's going to be a sustained effort, and we will all need to continue that effort in Alert Level 3 and on to Alert Level 2. Thanks very much.
Sorry, just on that, internationally, a lot of people have praised us, with that headline. Is that, would you like to correct some of those?
Correct the international headlines?
Yeah, they've sort of said, I mean, not that either of us have the power to do that, but they've said that, New Zealand's eliminated it. Do you want to correct that information?
Well, I think we've been clear here about what we mean by elimination, and it's not eradication. We haven't eradicated the virus, but we have achieved what we wanted to achieve in our ongoing goal of elimination.
This is clear as mud, really, isn't it? Because the Prime Minister's been talking the whole time about how we're going to be one of the few countries in the world, or we hope to be, that can actually eliminate this virus. Yesterday, people celebrated because we thought we got there. As Jess says, the New York Times is running big headlines saying New Zealand's eliminated the virus, and then today you're standing up here saying, no, that was just under level 4, not level 3.
Well, I hope my explanation today has helped to clarify that if there was mud yesterday, the water is clearer today, and I hope you'll all have a good understanding of that, and that other New Zealanders do. Kia ora koutou, thanks very much.
Kia ora koutou katoa, good afternoon. And welcome everyone to day one of Alert Level 3. I want to begin by stressing that at Alert Level 3 we are not out of the woods. As I have said before, it is a recovery room of sorts to assess if the incredible work that New Zealanders have done at Level 4 to break the virus's chain of transmission and prevent further community outbreak has worked. As Susie Wiles said today, there may still be some smouldering ashes out there, and they have the potential to become a wildfire again if we give them the chance. It can take from 2 to 10 days for people to have been exposed to COVID-19 to come down with symptoms. That means we wouldn't smell the smoke for a few weeks, and that could put us back where we started before the lockdown, end quote. So with more people going back to work today, we need to be even more vigilant at Level 3 to prevent any inadvertent spreading of the virus. We must continue to stay home where possible, including for work and education. Please stay regional and limit non-essential travel. And even though you can expand your bubble, keep it as small as possible and exclusive. And finally, if you're sick, stay home and contact your GP or healthline and get tested. It may feel like a minor symptom to you, but it could be a significant issue for all of us. What Level 3 does represent, however, is the move towards getting our economy moving again, to getting more New Zealanders back to work and to opening more of our businesses. Businesses restarting at Level 3 will see around 400,000 more New Zealanders back at work, taking the total to around 1 million Kiwis working. At Level 3, around 75% of the economy is operating, with key sectors like building and construction, forestry, manufacturing, and contactless retail starting back up. Importantly, major infrastructure projects start up again today. Over 1,000 road and rail construction workers are back working on major projects like Transmission Gully and the CRL in Auckland. However, we also know that the lockdown has displaced many workers, and there is real need for jobs in our community. The government, we will do all we can to ensure we fight the economic impacts of the virus in the same way we did the health threat, with unity, with fast support, by looking after one another. I'm joined here today by Minister for Social Development, Carmel Sepuloni, who will have more to say on further measures we have put in place to support workers and businesses, including an online job platform to keep workers and companies connected, extra employment centres, and agreement with industry on providing rapid micro-credentials for people needing to retain. I'll hand over to Minister Sepuloni.
Thank you, and good afternoon, everyone. Over the last few weeks, we have paid out $10.46 billion worth of wage subsidies to keep 1,694,281 New Zealanders in work and connected to their employers. It's been a huge task to implement, but also a satisfying one. The feedback from employers and employees has been overwhelmingly positive, but we still have work to do. As a government, we need to continue to be responsive to the evolving situation in response to the impacts of COVID-19. We know that a big part of keeping people connected is about keeping New Zealand working. Even before lockdown, our government had developed and launched our employment strategy in August of last year, and I acknowledge our Minister for Employment, Willie Jackson, for his leadership on that important work. And part of our welfare overhaul was seeing MSD ramping up employment-related focus. Last year, we boosted MSD's work-focused case managers by 263 and invested significantly in programs that support both employment and upskilling and training like mana and mahi. Before New Zealanders went into Alert Level 4, the government worked quickly to stand up rapid response teams from MSD across the country to work in regions immediately affected, regions like Tairāwhiti. These teams have been helping to connect people out of work up with employers in some of our most hard-hit sectors. Under Alert Level 4, MSD continued to place people into work over the phone, including supporting the redeployment of people to essential services. This work has made a difference for many New Zealanders, and we're still poised to respond in earnest. As a result of the impacts of COVID-19, unemployment will rise before it improves. We need to continue to act quickly to keep New Zealand working. That's why we're announcing today a suite of Keep New Zealand Working employment service initiatives to support those who may be out of work or at risk of losing their job. These will be delivered through MSDs so that we can effectively engage with more New Zealanders in this unprecedented time. The Keep New Zealand Working online job platform is now live. It connects job seekers, any job seeker, directly to the employer, making it quicker and easier for people to find work. It also provides training courses for those looking to upskill. You can access it via the Work and Income site. We will also have 35 new employment centres across the country. Through these employment centres, MSD staff will work with employers and job seekers under level 3 over the phone and online to match up employment opportunities. This will expand to face-to-face engagements with clients and employers and providers under level 2. We are implementing other services which will fast-track those people that need to re-engage quickly with the job market, and a specific service for those directly impacted by COVID-19 who are not on main benefit. These initiatives are key to supporting New Zealanders during a time when rising unemployment due to COVID-19 is a global phenomenon. We're already seeing dramatic increases in unemployment in countries around the world like Australia and the UK, and New Zealand has not escaped this reality. Finally, I'd like to say we administered the wage subsidy for 1.6 million workers successfully over 4 weeks of lockdown by working hard and being adaptable. We will deliver our employment efforts with the same dedication and resilience to keep New Zealand working.
All right. Thank you, Minister. We're happy to take questions.
Prime Minister, do you stand by your statement yesterday that we've won the battle when it comes to contact tracing?
You'll remember, of course, the Director General pointed to his view that we have reached a gold standard, but I continue to place the caveat on that when it comes to contact tracing, we've managed to do that in an environment with a low number of cases and whilst we've been in lockdown. The key for us will be, as we ease those restrictions, maintaining that level, but also for that, I call upon all New Zealanders to help us. If you have symptoms, get a test, because the clock starts running and counting down as soon as you feel sick.
So you maintain that we've won the battle against community transmission?
On community, but it is an ongoing battle. There is not one point in time that this mission ends now. Yes, we have done that in lockdown. The goal now is to keep up that work. So we're now in the next phase of the battle and we are not done. I don't think anyone will dispute that I've said that continuously, and you've all benefited from hearing that ad nauseum.
A magic number that you would keep us, a magic number of cases that you would keep us in level 3. What's the number of cases that would count as that wildfire that you talked about?
Yeah, you'll recall that actually I pointed to a scenario in Taiwan, for instance, where they've managed to get down to very low numbers of cases, sometimes 0, but in recent days they've had the return of a Navy ship that has brought their caseload up. So it very much depends on the circumstances. But again, I also rely on the advice and information by our epidemiologists and by the Director General as to whether or not we're in the position to move to a lower alert level. Yeah, Jessica.
We heard from small businesses at the Select Committee this morning saying that they're really struggling, and with only a handful of cases, why are we still in all these restrictions under level 3, especially with people like MPs and ministers coming back to work? Can you justify to them why they can't?
Yes, and look, with caution, and this is where I would really cannot emphasise enough, no one wants a second wave in New Zealand, and we must guard against that. So we're moving cautiously down through the alert levels so that we don't have to go backwards. That would be terrible for New Zealanders' health, but also the economy. So it is about moving with certainty in the hope that we don't go backwards. The next point I would make in terms of why is it that some workplaces are going back and others are not? We have placed special requirements at alert level around things like retail, or where you have high degrees of contact with large numbers of people. In this room right now, we know everyone who is in this room. And in workplaces, we are able to manage then who people are having contact with. Much harder in hospitality and retail, where you have larger numbers coming together and often in close contact.
In terms of timing, will you give people warning?
Yes.
I know the 11th of May is when you will decide, but how much warning will you give people?
Well, look, as a general guide, I've never come down here and have no intention of coming down here and dramatically lifting alert levels in one announcement without there being a timeline for the way that will be implemented. Of course, you will have seen to date that often we've given a period of notice, whether it's been 48 hours or others. That's always been so people can plan and prepare, and so that we can do it in a really confident and controlled manner. And I think, by and large, that's been an accepted approach. Yeah,
Government have done a better job in communicating what elimination is, because yesterday Dr. Ashley Bloomfield said that we had achieved the goal of elimination. Obviously, what he was referring to is achieving the goal of elimination, or the goals of elimination, under level 4.
Yes.
Can you understand why people are very confused?
No, you will have heard, and this is, I think, just a simple matter of the fact that we are now entering into the world of epidemiologists, and they know well what each of these terms mean in a health sense, but of course in an everyday sense they mean often something different. You'll have heard me continually say elimination does not mean 0 cases. It will mean an ongoing campaign and 0 tolerance for cases. We will have to keep stamping COVID out until there is a vaccine. We are not done, but you can see that we have managed successfully under lockdown to end community transmission. We need to keep doing that as we go. Yeah, down the back.
Last week, Phil Twyford told attendees at a conference that any move by councils to trim rates will impact the government's ability or willingness to invest in partnerships and infrastructure. Is that the government's policy?
Oh, look, what we do know is that in the same way that there will be an impact on revenue for government, there will likewise be with council. But actually what we need to ensure is that we have a joined up approach for acknowledging that there are actually now, more than ever, a need to invest in infrastructure for the stimulus that we'll be providing, whilst also having an eye to the day-to-day impact of costs in all forms to households when many people are suffering the economic impacts of COVID. So those are the two competing interests that central government and local government will need to work on together. I'm confident we can.
Schools and ECEs open tomorrow. What proportion are ready to open? How many children are they expecting? And have some teachers already been asked to help out at other schools because of demand?
That I haven't had that report from the Ministry of Education, but certainly what I'm getting, the initial feedback I've had is that the numbers that are returning are very low. Again, I'd want to wait for the official word from the Ministry of Education, but initial signs are that we're expecting a very, very small number to return to schools. That's as it should be. We are still asking people to stay home and work from home and learn from home if they can, and I think you'll see tomorrow that will show up in the low number of people back in ECE and in schools.
Prime Minister, Māori around the country have been putting rāhui on rivers in a continued effort to keep communities. Say, for example, there's a rāhui on the Waikato and Waipa rivers. Local iwi at Waitahanui near Taupo have put a rāhui on their river, and it's stopping licensed anglers from fishing there. Those anglers are upset. They say they have every right to fish at level 3. Who's in the right here?
Well, we have not removed people's rights at level 3 around accessing shore-based fishing. And so that has been the decision that we've made within the alert level framework. Look, what we have continued to do is when local iwi have had concerns in their own areas, we've often been able to work that through. And so there I would ask iwi to work alongside DOC, those administering the licensing, and police to make sure that we're not impeding what are legal access rights and that we have given permission for.
So in this case, local DOC have shown some support from the iwi perspective. So if those things are put in place, you're happy for iwi to intervene in that way?
Again, we have made a decision nationally, and it is my job to make sure we have consistency there. We've said that we haven't wanted access to DOC land for hunters, but there will be some crossover, and we're accessing some of these areas will require DOC land access. So some complexity that I'd be keen for us to work through with iwi and with DOC.
Minister, we heard from small business owners this morning on the committee that in terms of make or break for their survival, it's going to come down to those commercial rents. Some are not doing anything to help, some who are deferring are still expecting full payment in coming weeks. What more, if anything, can actually be done to help them?
Yeah, and this is where we really did look into what we were able to provide here, and there were limitations on how far we could go as a government when it came to commercial leases. But what I would again point out is in the best interest of not just the New Zealand economy or indeed small business, but those commercial landlords in this particular environment, not coming to an arrangement that's workable for you and your tenant may end up, you may find yourself with a vacant property at a time that will be very, very difficult to lease. So here we just are encouraging that dialogue.
Clear though that message is not getting through. I mean, the Chamber of Commerce wouldn't have been saying this morning that it hasn't worked if it had. So that's not getting through. So what?
And in the same hearing, we had another commercial landlord who very much disputed that it wasn't happening. Again, I will keep continually reminding people, first and foremost, make sure you make the most of the tax provisions that we've put out to help with cash flow issues. Make sure you use the wage subsidy. Talk to your bank and talk to your landlord. In the meantime, as a government, we will keep looking and assessing what we can do to keep those businesses operating and keep people employed.
Down the back.
Even at level 2, with hard borders, tourism businesses or those exposed to international tourism are not going to be able to trade.
Yeah.
Is there a case for a special deal for them? Is that an area you're looking at specifically?
We've always said that we want to keep monitoring the impact on different sectors. And I'd say tourism would be a very obvious one. Those who work in the space of large events, let's not forget they were amongst the first to be affected and the last who are likely to be able to operate again. So there are specific areas where we are working on what additional support, redeployment or initiatives from government can support the ongoing employment on those people who have previously been in that sector. I'll just take a couple of more.
The wage subsidy being extended out from 12 weeks for those sectors that are really hard hit and aren't going to be back to normal.
And that's where potentially you start looking at more specific and specially designed initiatives that will address the needs of what are a very particular set of businesses. Keeping in mind with the wage subsidy, here we are after 5 weeks in, with a 12-week subsidy still in place. And so for us, it's actually looking at whether or not there are more specific initiatives that should be designed. I'll come in, Derek.
You said previously that...
Just remind everyone that the Minister's available for questions as well. Derek.
You said previously you can't freeze commercial rents. There's no legislative mechanism for you to do that. But now that the House is sitting again, have you considered any sort of emergency legislation?
No, it was not about the availability of the House, but the provisions under the legislation, which did not provide us the same provisions under the Residential Tenancy Act.
You're not looking at any legislative change to enable that?
You'll remember what we are looking at, and of course this requires the House, is arrears and the ability to terminate. So where we had the ability to make changes, we are. Okay, Gina, and then I'll take one last at the back. Yeah.
A lot of the small businesses were asking for direct cash grants
Yes.
or cash payments from the government for rent relief specifically. Would you consider those or interest-free loans?
Yeah. Again, what we've said all the way through is we are continuing to look at the impact COVID-19 is having, particularly on our small businesses, to see what more the government can do to assist. Not everyone is going to make it, but we do want to make sure that those businesses that are vulnerable but viable are supported as best we can. And then last down the back.
An immediate need. So will you do it? How quickly can they expect something from you because they're making decisions?
You'll see that in every decision we've made. We've always moved as quickly as we can. But the wage subsidy has been a very big part of trying to meet some of those immediate cash flow costs, and the vast majority has gone to small businesses in particular. Down the back.
The Minister, on behalf of a colleague, should migrants be put on a benefit in the COVID-19 world, and are divisions in Cabinet over a migrant benefit the reason that the government has not yet implemented this?
I think you would have seen last week that Cabinet made the decision to invest another $30 million into the CDM efforts. And that is to support not only with food but for accommodation where people are experiencing hardship. And so I just need to point out that that support through CDM is not just available to New Zealanders or permanent residents or New Zealand citizens, it's available to anyone that's here in the country.
Yeah. Okay. But the point is the provision of support is already there, Bernard. So we made sure that because some of this in need is immediate in the likes of Queenstown in particular, the fastest way that we could get that support in terms of accommodation, immediate food needs and so on was through that support on the ground through the emergency management team that we have down there. And so that is essentially what Work and Income would otherwise do, is being directly delivered through that form.
But the Minister was asked, will migrants who are stuck here have access to the benefit in the same way that
And I've just explained that this is similar to what the benefit would provide in terms of support.
Question on behalf of a viewer, they want to know about cemeteries and whether they'll be open under level 3 because they haven't been able to go and farewell their loved one under level 4 who died just before the lockdown.
Yes, obviously there have been burials, and those are now able to take place with up to 10 people as part of funeral arrangements. In terms of wider openings, that's actually something I would need to check at a council level. Thanks, everyone.
Thanks.